I'm Dr. Richard Mizer. I'm a family doctor. I've been with Adena for several years and in Greenfield for 34 years now. I'm a family doctor, and I also happen to be the lead physician for the Western region, which includes the Washington Courthouse, Greenfield, and Hillsborough. What patients are going to notice with the changes in the office, some things will be new, but you're also going to see old familiar faces. Everyone's wearing masks though. As you may or may not know, we've had to cut back some of the hours. And it's one of three reasons, one of which is to make it safe for us as providers and staff. The other reason is to make it safe for patients, and also to be sure we don't use up all of our masks and other personal protective equipment. So when a patient walks through the door, they're going to see a change. The waiting room is not going to be full of people. In fact, you'll find very few chairs to sit in, because the goal is going to be not to have people wait in the office. A lot of people will be asked to stay in their car, call from the car, and we will do registration at that point. And so when the room is ready for you, the exam room is ready, we'll bring you directly through to the exam room. So there's very little waiting in a busy waiting room. There won't be such a thing, and you'll be taken directly back to the exam room. We are taking precautions such as asking questions about travel or exposures, other risk factors, and everyone gets their temperature checked. All the staff gets theirs checked every single day, including me, and every patient who comes through. So there will be some screening questions. People who we think may have COVID, the coronavirus, they may be asked to stay in a car, and we will then ask some more questions and decide whether it's best to bring you into the office at that point, or whether we should refer you to the COVID clinic center where you can be screened there. So it just depends. But people are going to be asked more to stay in a car, and it'll be streamlined. And actually, I think in many ways, a patient would prefer that instead of coming into the office and sitting in a room with a bunch of people. It's still going to be the same staff. Our hours have been truncated a little bit, so we've shortened the hours in this first phase, and as we go into the second phase, those hours will be expanded, including evening hours for some offices that had that previously. So we've had to shorten them because we're seeing less people in the office face-to-face. We're doing more telemedicine, and a lot of you maybe have already been involved in telemedicine, where we are communicating with patients either by iPads, iPhones, and even just telephone as well, because certain things just can't wait, and so we've been doing a lot of that. As we're opening up now, it's safe to come in the office, and we want to see people smiling faces in the office with masks on, of course, because some things need to be taken care of, face to face that way. The first people that we want to have back in the office would include those with complicated medical problems, diabetes, hypertension, hyperlipidemia, people who are sick and need to be seen, obviously. And also kids. We don't want to forget about kids. Those of us who do a good amount of pediatrics, we want to be sure that kids are getting their immunizations and their well visits. So that's kind of the first priority. And then later on, when we expand the hours, we'll be including routine visits, wellness visits, things like that don't need to be seen immediately. As we move forward and we're seeing more patients back in the office, we're still going to have a place and time to do virtual visits. That's either by iPad, iPhone, Google Duo, or even just a telephone. There are some patients who actually we're going to encourage that and not bring them into the office. For example, if someone has symptoms that might be the coronavirus, then we may want to first do a visit like that, so it's safe for the patient. They don't have to come out into the outside into the office, and also keeps us safe as well. And there are people that are homebound, and so actually in a way it's been good to have this change in our workday, because we really need to get on board with doing telemedicine all along. It's kind of the wave of the future, and we've been kind of jump-started into doing that now. So we're going to continue doing that on a limited basis, because there certainly is a place and a time for that, especially for homebound patients. I think one of the great new services that we're offering is curbside lab draws. So it's great to tell a patient, it's time to get your A1C and your cholesterol tested, and people are fearful of coming in the office or going to the hospital to have that drawn. Actually, in our office, they can come to the curbside, near the door, and while they're in the car, call the office, and our lab tech, Heather, actually comes out to the car and draws the blood. It's an awesome service, and that's something we do plan to continue, weather permitting, of course. continue that into the future. One of the other things that patients may find is a little bit different when we have communication with you when you're in your car before you enter the building. We may actually ask you to come in by a side door or the back door because we also don't want you to spread the infection to others that may be in the way. So we will bring you in the back door if there is one available and take you directly to a private room for evaluation. The other thing that patients may need to know is that we're trying to keep all the facilities as COVID-free as possible. So, for example, if you come into the hospital in Greenfield or at Pike, there are no COVID patients hospitalized in that facility at all. Any patient that we feel has COVID or tests positive for that is being sent to the main campus at ARMC, and they're on a special floor there. So to keep those people isolated for safety of others, but also there will also be some limitations in which members of the family will be limited to in coming to the office. We ask that people not bring a bunch of family into the office, which is a little different for primary care. We're used to having people bring in mom and dad and kids, and we're trying to limit that to just a patient and maybe one other person if necessary as well. So that's a little bit of a change while we're going through this phase. One of the concerns of the family doctor I have is that people are going to be afraid to come to the office. They're afraid they're going to get infection. We've made that as safe as possible. I think it's got to be better than actually passing people in the grocery store at this point. We don't want people to put off things. So if people are ill, they need to be seen. You need to call us. If you need to be seen in the emergency room, don't be afraid to go to the emergency room. All these precautions are being taken care of in the emergency room also. One of the concerns is that people are not going to come to the ER when they're having a stroke. And we know that you've got to be there in a certain amount of time so we can help you and help reverse that stroke if at all possible. We don't want people staying at home and having their health get worse. So now it's safe to come out, come to the office, make phone calls. We can do things by telehealth. We can see you in person. When appropriate, we'll send you to the emergency room or to the COVID clinic to be evaluated.